Our guest, Dr. Bello Abdulmalik, is here with us in the studio, a medical expert, and together we'll be discussing Lassa fever, the symptoms, how you can contact Lassa fever, and most importantly, how to take care of yourself and also your environment. Thank you, Dr. Bello Abdulmalik, for joining us on Healthy Living today.
Thank you very much. It's been an honor being here, and it's a pleasure to meet you guys.
Thank you. Now, to start us off with, the topic that we want to discuss today, Lassa fever, could you explain in simple terms what Lassa fever means and, how one can get in contact with it?
So the Lassa fever is a viral illness caused by the Lassa virus. And how this is being transmitted is by rodents, most especially what we know as house rats. It's called the multi-mammate rat. So you find them normally in your household. So normally through their urine droplets, this is how the contamination occurs. So for example, they would contaminate stored food, for example, let's say gari or anything, and left overnight, then the person living in the house comes in contact with maybe surface of where the droplets have been dropped, or maybe urine or any part of the household, then they get affected with the virus, and this is how it all starts. So prevention is one other thing that's a key thing. Whenever you see the rat, it doesn't look sick; it looks healthy. So having the virus in the rat doesn't make the rat look sick. It can stay inside the rat for the whole span of its life, and that it will survive. So the main is just like a means of let's say how it contaminates other types of where it gets food, because when it tries to get food, then it contaminates the area, and then the person living there get affected, and that's how everything happens, and that's the beginning.
Now, one confusion concerning the symptoms of Lassa fever is that, for some people, they will say that the confusion between both symptoms is between malaria and typhoid. And you would agree with me that in Nigeria here, once you're ill, the first thing is, I'm feeling a type of way. I think I have symptoms of malaria.
Exactly.
So walk us through the symptoms of Lassa fever, what people should look out for when they start feeling a certain type of way, and they'll be able to point to, I think I'm being infected with Lassa virus.
This is actually a very good one, because you see, when people have, just like you mentioned, any type of illness, the first thing, even in the hospital, the first thing they look at is malaria. This is what they go for, because it starts with high fever and then weakness. So how do we differentiate between malaria and Lassa fever is when you have that fever for more than 48 hours and you've treated malaria and you still have that fever, then it means that there's something to look at. Then it means that definitely there's something other than that malaria. And then we start looking at Lassa fever. And then eventually, when you have sore throat with that fever, because normally when you have malaria, you might have cold, but when you have persistent sore throat and difficulty in swallowing, then this is where you point that, it might be Lassa fever or something of that sort. And one of the key things for specifying Lassa fever is hearing loss. So it might be very interesting that you see people have fever and then they'll start just like if you remember the COVID-19, where people can't smell perfume.
Absolutely.
Exactly. So one of the key things to look at is when you start having hearing loss, because this can happen during the infection, during you having that infection. Even, people that have Lassa fever, after the Lassa fever, they end up having permanent hearing loss. So, when you see that, you have fever for more than 48 hours and it's not actually alleviating, even with medications and all, even after malaria treatment, then you start looking for Lassa fever is kind of the thing that is supposed to be looked at here.
And also, we need clarity, Dr. Bello, because we understand that, one can contact Lassa fever through, rats. But then there's another one, having contact with someone who is infected with the virus. So walk us through how this transmission goes from person to person.
Exactly. That's also a very good one. When you take a look at, airborne diseases, so normally it goes by when you sit close to the person, then maybe let's say the person is close to you, that it goes through the air. But here, it gets transmitted through bodily fluids. So, for example, like maybe someone is sick, let's say they have fever and they're sweating and all of that, and you're taking care of that person. So now that sweat, you coming in contact with the bodily fluids of that person. That's how you get contact with the urine, urine, blood, any bodily fluids. Then that's how you get in contact with, and you get affected. So that's why I'd advise, like most people, caregivers and everything, they use gloves, especially just like I said, when someone start having that fever, sore throat, and hearing loss, it gives you keynote that this might be Lassa fever, and to prevent yourself you need to stay away from their bodily fluids. Staying close to them doesn't mean you can get the Lassa fever, but like saliva, sweat, blood, urine, any type of bodily fluids.
Quite an interesting one. So based on reports, there are parts, or rather states in Nigeria that I think Plateau State, Benue State, Nasarawa State, that have recorded, cases of Lassa fever. What part in Nigeria are really prone to having these virus? Or not that other places cannot, get this,
exactly.
yes, but at least we should know that, there are other places that could be, a major hit to Lassa fever.
Yeah, I like how you put the fact that, it can happen anywhere. Why? Because how it starts, it's like one of the main things, the essential things is overcrowding. Any place that, is overcrowded, let's say, close to the marketplace, you definitely find rodents. Absolutely. Definitely. People having stored foods and, storing, like drying their foods on bare ground, all of these things, these get contaminated easily. And, when people live in, let's say, like this north central part of the Nigeria, where you see, people are living in crowded houses, so the infection can, spread rapidly as fast as you can, as wildfire, so that's why, when you mention the particular area, it can happen actually. It doesn't have a specific zone. It can happen actually where people are mostly overcrowded.
Okay, it help us right now, because each time people talk about Lassa fever, you hear some person saying that, this virus comes during the Harmattan season, or it comes during the rainy season. Is there a specific period of the year that, this Lassa fever do come out more than other seasons?
Yeah, during the public health assessment, like normally Lassa fever peaks during November towards April. Why? Because during this moment, you'd notice that these rodents, they search out for food. This is the time that, they normally, go into households searching for food. Because like I told you, like it's all about them trying to survive and get food. Now, having the virus in them, through trying to get means of survival, then they contaminate all of these things. So the recorded peak, months are during this time, and it falls to be, during the dry season. And that's why we say, it happens during the dry season. And one of the key things that you'd actually see is that, when they have drop-ins, so when you are trying to sweep off those drop-ins and you're not careful, the virus, it actually goes airborne. It goes into the air. So now when it goes to the air, you inhale it, and then you also get affected. But now during the rainy season, everywhere is wet. And that's why if you're also trying to clean your household, instead of you to use just maybe just sweeping, you should rather use wet mop to make it wet, so that the virus will not, actually go into the air and you inhaling it. So this is also another key thing to look at.
Okay, so I remembered growing up, and I think even now in some urban, should I say, yes, in rural areas, I beg your pardon, when you see people sweeping their environment, they always sprinkle water on the floor. So that is better when you're taking care of your environment. Yeah. All right, beautiful. And now let's look at age brackets in which, people can contaminate this Lassa fever. Is it only, prone to adults only, or children in some specific age? To what age bracket really can people contaminate this virus?
The Lassa fever, because it's a viral illness, it can affect any type of age bracket, and most especially it affects pregnant women, because during the late stage of pregnancy, this is when the pregnant woman she's more prone to disease, and this can actually affect her and the baby. So that's why, like when we're giving awareness for Lassa fever, we actually give more awareness to pregnant women, because we're losing two, people at the same time. So it can affect immunocompromised, patients, people that are elderly, and children. So it's kind of like an overall scale of, it can affect everybody.
So what's your experience with, patients walking into the hospital and, being diagnosed of Lassa fever? Because there's a report that came out recently of doctors being, affected with Lassa fever as well, when they're treating patients that are already, affected. And then some health workers even get to lose their lives because of this very, yeah. So what has been your experience so far, having patients walk into the hospital and then, you run tests and do all the necessary things you need to do, and then later you find out that this person is infected with Lassa fever?
Yeah, and that's a very good question, because when patients do come to the hospital, like one of the things that make it very easy for health workers to get contaminated with this, when, for example, already you have lots and lots of patients, and then we bring someone in the emergency with similar type of traits like malaria and stuff, but like I said, like when we have a health system that is, already, state of the art, everything is, already checked, and safety procedures are being followed. And with these safety procedures, that's why you can't, self-treat yourself at home. That's why you go to the hospital, because safety procedures have to be followed. You'd have to wear your gloves when you're treating a patient, even if you need to wear your masks, So, at the hospital, when we have, patients with, these type of, let's say, Lassa fever, identifying them, we prioritize them, prioritize them. Why? Because it's something that, it can be contaminated, like people can get contaminated. So it's, when you prioritize them, it's seen more as an emergency. So when it's seen as an emergency, it's going to be we can actually curb the mortality rate of, because one thing about Lassa fever is, early treatments, save life. Like there's no cure for Lassa fever, but when you can treat it early and the antiviral drug is being given, that you can be able to save the person's life.
Okay, so I like the fact that you said, early detection and early treatment. And this brings me to my next question. Why is early diagnosis so important? And, what should someone do if they suspect that they might have Lassa fever? What should they do?
So just like I mentioned, I said, like, the Lassa fever is a virus. So it attacks your body vigorously. It doesn't go like, mild. So, and once you go to the hospital, you're being given the antiviral drug, the ribavirin antiviral drug. So this drug, it actually, stop the replication of the virus inside your system as early as it can be. The reason why when we have late treatment, it can't work out. Why? Because once it goes late, then we have, organ failure, like your organs start to be affected. Just like other, when we have rabies virus, the same thing. Yeah, when you get treated early, like you tend to, survive it. But when it's late, when it reaches a certain point in time whereby you've already started having organ failure, then that's it. Because the virus, tends to, multiply and, tend to survive in your own body. So as much as possible, they'll try to find any means. So once you go to the hospital, as much as, having just a weakness, lethargy and the feeling headache, constant headache, and you treat malaria for 2 days and you see you're still having the same thing, you have to go to the hospital.
Okay. So is there a vaccine for Lassa fever? Apart from, the treatment, is there a vaccine for it? So,
vaccines have been actually tried out, but still on, clinical trials, but haven't been made to the public yet. So I think it's still something that is ongoing, and hopefully, I think it's something that, these clinical trials, once they become positive and, we find a vaccine, it's really going to help the population and the whole world itself.
So for people living in rural areas, because they're prone to, Lassa fever, what are the basic steps that they need to take concerning taking care of their environment, their homes, as not to invite these rodents to their households?
Yeah, so when you live in these rural areas, one of the things that you have to do is, you have to block any route that, that rodents can come into your house, like holes, like passages and all of this. And but before you go to bed, like if there's any type of stored food, you cover it and make sure that you don't dry your foods before you go to, for example, like drying your foods on bare ground. You have to make sure that it's been closed and then sanitation. Like when people go for community sanitation, it doesn't.
Do people really do community sanitation these days? Well, I think that has paid off a little.
Yeah, they don't actually do that. But doing community sanitation actually helps because it's not about the cleanliness, but prevention of the diseases, prevention of so many diseases. So once you'll be able to do the community sanitation, droplets, urine, everything will be cleaned out, and you'd have a hygienic place, and you'd avoid it, because the main thing about the Lassa fever is prevention. As much as you can do whatever you can, if you can be able to do the prevention as much as possible, then you can curb the rate of the spread of Lassa fever here in Nigeria, of course.
Now, Dr. Bello, I'm very particular about people living in rural areas because, of course, yes, they would have, limited access to healthcare when they fall ill and, of course, when they have this illness. Do you have an idea if, primary healthcare centers in communities or in, other parts of the country have this treatment for Lassa fever as we speak?
Like people already the government have already started working on some projects, especially primary health care.
Okay.
And in some states I've seen, like especially let's say Kwara State and Niger State, they've started on having the needed treatment for people living in these rural areas, and then having given awareness, because like I told you, since we don't have a cure, awareness it actually deals 70% of everything, because once you're able to know that, look, when I have these rodents in my house, I can be able to get this type of disease, then you try to avoid anything contact, because once you don't know, some people even like they tend to pursue the rodent with their hands, and all of these things. So they don't know. But once they know that, look, when I have any contact with this rodent or anything, I can contact this virus and it's deadly. This is what it gives. This is what it does. There's no cure. And of course, like they will be preventive, and that saves us and saves a lot of stress.
Now, you said, some people would, also pursue these rodents using their hand. Now, I don't want to discriminate some parts of, some states in Nigeria, but there are actually people who feed on these rodents, like they eat, like you have the bushmeat and what have you. Can one contact Lassa fever through eating bushmeat? And all of that.
Yeah, of course, because like just like I mentioned, like if you'd see that the what they call it, the droppings of what they call it, these rodents on your food would actually give you the virus. Then eating the whole rodent itself, like there's no debate about
but people will actually debate and argue that this rodent is being roasted, and people have this perception that anything that has been heated on the fire, whatever disease or virus that thing has, must have gone down because of the heat coming from the fire. What do you have to say about that?
That's where I actually strongly argue, because handling the rodent itself, let me tell you, like imagine you want to like roast the rodent. Of course you have to prepare the rodent, and when the rodent does its feces and everything, it steps on it and then everything. So now you touching it and everything, like let's say like you cook or roast it, and then your hands already, the one of the routes where people get viruses, illnesses, is they touch their body without them knowing. You scratch your nose, you scratch your eyes, and you don't even know it happened. So already you get infected before even eating the rodent. So that's the main thing.
Absolutely. So time is against us, but quickly, just in a minute, looking ahead, what gives you hope in the fight against Lassa fever in Nigeria?
For a couple of years, like I think 5 years ago, even when I entered the health sector in Nigeria, and I saw I worked with the public health organizations, that we did a lot of awareness, and I can see even during that time, you'd see like the awareness actually helped, and I would presume that even right now, the awareness is still ongoing. But I would suggest if when people are able to reach out to these rural areas, because that's the majority of places where we need to actually give awareness to.
Absolutely.
And then, you know, give maybe, let's say, detergents, you know, like hand wash and all of these things, because people need to, you know, once you do those cleaning, you need to wash your hands, of course,
Immediately,
because
true.
washing your hands is one of the main things that, you know, actually prevent you from, you know, getting infected.
Absolutely.
Yeah, so I think that, yeah, we actually have hope. And yeah,
Thank you, Dr. Bello Abdulmalik,
thank you
for
very much.
coming on the
Yeah.
program today, Healthy Living, and, you know, schooling us and telling us the necessary things and the basics we
Yeah.
need to know about Lassa fever.